Welcome to the Health Angle Podcast with Dr. Mike Headlee and Dr. Gordon Fimreite, where we'll be exploring different angles of health to achieve the best version of yourself. Now here's your hosts, Dr. Mike and Dr. Gordon.
Welcome everybody. I am Dr. Mike Headlee, and with me is Dr. Gordon Fimreite as always, and we have a very special guest that we're going to introduce. Dr. Akande is a board-certified pediatrician with over a decade of clinical experience, blending modern medicine with a deep passion for integrative and holistic health. His unique approach weaves together conventional care, traditional healing systems such as Ayurveda, and lifestyle interventions to guide individuals and families toward balance, healing, and sustainable well-being. Dr. Akande holds board certifications in general pediatrics and clinical informatics, alongside fellowship training in both integrative medicine and Ayurveda. Beyond the clinical setting, Dr. Akande is a dedicated educator and advocate for empowering patients to take practical action steps towards better health. Through storytelling and sharing his personal wellness journey on social media, he inspires others to explore the transformative potential of integrative care. So welcome, Doctor.
I'm so happy to be here, and thanks for that generous introduction.
Yeah, thank you for being here. So I'm going to start off with the first question, and just to give our listeners a little bit of your background. Tell us a little bit about where you grew up in your education and a little bit of insight on your journey into health care arena.
Okay, so I was born in Canada, but I was moved back to Nigeria with my parents when my dad finished his PhD. So from age 3 till after medical school, I lived in Nigeria. And the earlier part of my life was quite rough because I had childhood asthma, and that made me be quite familiar with the hospital system or clinic systems. And at some point, I feel like due to constant contact with healthcare personnel, I thought I wanted to do what they did as well, especially as pertains to taking care of children. So that's really what ignited my desire to go into medicine. I think I decided since I was 6 or 7. And I did my medical school in Nigeria. Then I came to the United States to do a master's in public health. That brought me to Hopkins. And the intention at the time really was to move from the clinical practice of medicine into health policy. But you know how life happens. I came to America, I stayed back, I decided to go into pediatrics residency. And then after my residency, I moved here to Bemidji as a general pediatrician. At some point, I left to go do a fellowship in clinical informatics. That took me to Seattle, Washington. And then I came back again during the pandemic. So it was during the pandemic that things really changed for me on like mind-body philosophical level. I had to go back to basically my origins. I did contract COVID during that period, and my folks back home were like, dude, there are herbs here in Africa that we use. Get yourself together. So some of the things they told me to try, I found it very, very helpful. Just basic stuff that I could get from a grocery store. And that's when my desire to pursue natural approaches to health started. So I went again to do another fellowship, this time in integrative medicine. And along with that, I got a master's in Ayurveda together with it. So the intention now is that I'm going to practice as an integrative physician, combining both modern medicine and integrative medicine. So that's my story.
Nice. Thank you for sharing that.
You know, was it a difficult change? Not change, but I think a lot of people had a kind of the lights went out, kind of the lights turned on because of the pandemic. They started looking at things a little bit differently. What was the specific thing that happened during the pandemic that made you look like, you know what, we got to look at medicine a little bit differently, not just allopathic, but we got to look at the human as the human and look at natural things. What happened?
I'll say a lot of things. So I got burnt out. And as I was burning out, I also saw it in my patients. So it was like the numbers of kids that came to my clinic for mental health related things skyrocketed. Anxiety, depression, it was just mind blowing. And these are children. And I found it very frustrating that the only thing I could essentially offer them was medication. The psychologists and the psychiatrists were like overbooked. So some of them couldn't even get in. So the most I could do was just doing minimal counseling and then medication. So that's a big part, just that lack of tools other than pills. And then the other one was, like I said, COVID was still very new. We were all scared of the virus. And then I contracted it. I lived alone. I did get the Paxlovid, but it made me crazy. So the other things that I needed to do for the symptoms I was feeling, my aunt back home told me just some brew that I could make with citrus and cinnamon and ginger and garlic and all of this. And I found it to be very, very therapeutic, helped me to hydrate well, helped my secretions to thin out. So all that together made me remember that, guy, when you were a child, you didn't go to the clinic for every small thing. We treated ourselves at home using things from our garden. And then we go to the clinic if it doesn't work. So I'm like, there are natural things that can work. Let me go learn it formally. And the final thing I'll say is I've had a number of patients who actually taught me stuff, whether it's use of essential oils that I snickered at when I first heard. But then when I had a headache, I tried peppermint and it worked. I'm like, oh, okay. There was this other mom whose kid had the worst colic I ever saw. And she came to my clinic almost 3 times a week for a couple of weeks. And then finally she came again and the kid was fine. And she was like, I took my child to a chiropractor and he fixed him. I'm like, okay. So point is, I just had to learn about other systems of health, and integrative medicine was a way to go learn it.
Fascinating. Thanks for sharing. Just a real quick follow-up, then I'll throw it back to Dr. Mike for his next question. With your colleagues, you're all medical doctors. Did you find any resistance in the medical field from other colleagues?
Yeah, I do know that out there, a lot of people don't believe it's science or evidence-based. And I try not to get into arguments online, but once in a blue, I get into it. So yes, it's still not mainstream. It's something new. But the good thing is in a lot of the Ivy Leagues, they're beginning to have these fellowships and, big names always lend credibility to things. So I'm thinking in not too long, there'll be more acceptance of other methods of care.
Were you allowed to suggest some natural things along with maybe a antibiotic or prescription to the parents for a lot of the sick kids that you saw?
Well, yes, in clinic, I've always done that, but they're like the minimal, basic minimum, like honey or ginger. Everybody knows that it's in up to date, so we do that. But there are some that are also very evidence-based, but not mainstream. Like let's say ADHD, for example. Some people, when they see a doctor for ADHD, they just get Adderall or some other medication for it. They don't have the other supplement that could be supportive, like omega-3s and vitamin D. Let somebody check their zinc level, their iron level, and fix all that with supplements as well. And then there's the mind body involved as well. So, baby steps, I guess.
Sure. Did you have one type of patient or client that you really, really resonated with, that you could really connect with and help the most, whether it was ear infections or anxiety or digestive, or what was your favorite type child to work with?
I haven't really had a ton of openness to this in this community. A lot of parents come at the first sign of fever, literally within 2 hours. So they just believe in modern medical methods, pills. So when they come and it's something that I feel you can support at home and I'm having that conversation, it's just like, we're going to go to the walk-in clinic for an antibiotic. So, but for those that are already into it, they come with their whole paraphernalia. They're like, have you heard of this? Have you heard of that? And I did learn a lot from them before going to get my own formal training. I'm seeing a shift in more with patients, to be honest, and that often drives us as well. So it's like the patients are leading us, the providers. A lot of it. I'm guessing why I haven't seen a big shift in my patient population is because I no longer work in the clinic. I'm now in the hospital.
Mhm.
But online, in just face-to-face conversations, people are moving more and more to just taking charge of their own health and de-democratizing healing, really. Not everything should reside within hospital or clinic systems. We also have knowledge and wisdom. Our body has that innate capacity to heal. And it's about teaching ourselves to recognize that and to support it and to feed into it. So I think we are definitely seeing that shift for sure.
For like some of the medical interventions using drugs and pharmaceuticals, does the CDC, do they have like a newsletter that comes out where if you get this, you should go with this. If you go with this, it just seems so cookie cutter versus like really evaluating many aspects of why and what's the cause, what's the root cause of these problems.
I think this knowledge is not new. There were these ancient systems of health like Ayurveda and traditional Chinese medicine that already recognized the holistic nature of humans and have that approach to healing. So when modern medicine developed, it also recognized some of that over time, like recognizing that poor sanitation was linked with cholera, or that milkmaids who were milking cows were somehow resistant to smallpox. So just recognizing that interrelatedness of us and nature and us and the environment. So it's all been there, but because how health systems are funded, because of how we get paid, things have to go fast. So doctors are trained to go boom, 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 boom. You have 8 minutes in and out. So it has to be problem focused. So when someone comes in to see me for an ear infection, it's problem focused so I can get them in and out, and the next person who also needs to see me can come in. And I believe that's why integrative medicine is developing. There's a lot of support from it from the WHO, and now the NIH is pouring billions of dollars into developing this field. Now, in integrative medicine, if someone comes in with, say, otitis media, I'm not just writing them a script for antibiotic along with, say, a probiotic. I'm trying to get more understanding of why. Why did you get this? Some of them have a bottle in their mouth all night, or maybe a pacifier, or they're genetically predisposed, or their immunity is just a little bit subpar. So we kind of look at all of that and be like, how do we nourish this kid and improve their immunity? How do we get rid of the predisposing factors? More holistic approach, basically.
So I have a question about the United States is statistically 51st in overall health, roughly. We're the most obese or the second most obese country. We're fat, sick, and nearly dead in general. We aren't that happy. And growing up and living in other countries, and I know you like to travel and have family in Texas and other places, what's your opinion? Why are Americans so fat, sick, and nearly dead?
I'm guessing more than a few things, but the thing top of mind for me would be our food system. Our food system is not the healthiest. It's highly commercialized. So the farming system, for example, this monocrop planting, so the soil is completely depleted. The plants that grow on those soils are not as nutritious as they could be. The animals too are not nourished or cared for in a humane way. Many of them are like eating while standing in their own shit. Excuse my French. And the people that process them too are not really cared for. So they're like, it's like what do they call it? Conveyor belt type of thing. They're cutting and cleaning and moving. So all this, like I said, we're all related as Ayurveda believes. So when you're eating all this food that's not prepared with love, then it harms us as well. And then our standard American diet is also not healthy. It's highly processed. There's a lot of sugar. So on top of the fact that the grains are not nourishing already, then we process them way too much that it's also harming us. And then stress level, I think there's a lot of hustling here in America where, you want that big house and four garages and your holiday house and all of that. So there's a lot of stress, a lot of pressure we put on ourselves. America is like a leader in so many things, and you feel it on a day to day because everyone is competing. You want to be the best and the first and all of that. So all that, and of course the social aspect as well. There's a lot of unfairness in society, which again adds stress to our lives. Some people can't even eat while others are throwing food away, like literally throwing away very good food. So all that and probably more,
Yeah. Thank you for sharing.
Yeah.
Yeah.
You seeing more parents kind of being more proactive and jumping into the health arena and are open to this ideal of, hey, maybe I can do this natural approach. Are you seeing more and more of that? Is that becoming more of a trend? Because I know traditionally, give me the medicine. I want to get out of here. We're kind of in a quick fix society. I want results and I want them right now. I don't have time to wait. Are you seeing more patients? What are you seeing?
What my experience was before I went to get this training is that people would pause and listen if you're patient enough to encourage it. So there are some people that insist on getting a script. And I feel like, you know what, if I write a script and a colleague should come read my charts, they won't think I'm completely crazy. I'll write it for them, but I'll say to them, don't feel it yet. Try this one or two things. If things don't get better, then go feel it. They feel happy that they have the scripts that they came in for, but now they are open to listening to those other conversations. So ask me again in a year and I might have a different answer for you. I don't know.
Sure. Dr. Akande, my experience with Ayurveda is it's specific to the individual, meaning they type dosha types, and you could have a primary and a secondary. I'm a Pitta type, and it involves mind, body, spirit approaches. So I should eat according to my body type. I should exercise according to my body type, and seasonality, etc. I'm curious what drew you to that type of healing and functional medicine integration, and what do you love most about it?
Everything you said. So, I honestly still don't know what was wrong with me, but right from medical school, I just had this discomfort in my abdomen. So it's not pain as such, it's not bloating or gas, it's just it doesn't feel right. So sometimes subconsciously I'm like rubbing my belly. And that has been a thing. So I've never seen a doctor for it. It doesn't really do anything beyond something not quite sitting right. So during the pandemic, when everyone was on lockdown and, social distancing was happening, I didn't have any friends to hang out with. So I had time to study and figure out stuff. So it was at that time that I started to try tweaking my diet. So the first thing I got rid of was milk, which transformed my experience hugely. My energy level went up, my skin cleared. And then as I researched more, I found a book in the library on the Ayurvedic diet. And then it was so fascinating, everything you said, like the doshas. So doshas, to the listener who don't know, that's like your constitution as described in Ayurveda. So our constitution, we have a mind constitution and a body constitution. And there are like three main types of doshas. Vata, those are the airy people. Pitta, fiery people. And the Kapha, more earthy people. Now, each of these doshas are a combination of different elements. So the Vata are like air and space. Pitta are fire and water. Kapha are earth and water. And with these different combinations, it makes us act and behave differently. So Like Dr. Mike said, the Pitta people, those are the fiery types, the fire and water. So just think about someone that has a lot of fire in their mind, right? So they're more like driven, goal-oriented, ambitious. Then fire in your belly, is like your digestion is fast, your metabolism is also high. You're moving your bowels 2 or 3 times a day. So that's like when it's balanced. Now, when this pitta is not balanced, then too much fire in your head that you get irritated easily, frustration, anger, or too much in your body, you could manifest as skin rashes or acne or hyperacidity, reflux, hot watery stools, just like that. And the same thing applies to the other two, which I can describe if you're interested. But points I'm trying to make is with these different constitutions, we have propensities to certain things, and we also have like we're skilled or gifted in other stuff. And this affects our nutritional needs. So for the pitta, I'm just using pitta because I'm a pitta too, as an example. Okay, talking about nutrition in more depth, the tastes, the types of foods that align most with pittas are the sweet, astringent, and bitter foods. So you want to prioritize these. And also when your pitta is too high, like in the summer, then you want to bring it down by favoring cooling foods. And the same applies to the other, to the vata and the kapha. So nutrition varies based on your constitution, and the same thing applies to body movement needs. The kapha types can sustain lots of heavy type of exercise. The pitta types, you really want to be gentle. And the vata types, very light exercise, so like walking, yoga. Kapha can do weightlifting and all. Pitta can be in the middle. But one thing that we want pittas to avoid is competitive sports, because they're already competitive. So you're in that competitive sport, it's like you're just aggravating your pitta and like you're just too much drive, too much fire.
I love
That's
that.
what I've loved. Yeah.
Thank you for sharing that, because that's what I loved about studying it too, is the individuality. Instead
Mhm.
of telling everyone to do yoga or everyone to be a runner and go to
Mhm.
CrossFit and get big muscles,
Mhm.
and everyone should eat only salads in the summer. Well, some
Mhm.
people probably need to warm up in the summer depending on their body type. So
100%.
that's what I love about
Mhm.
that. So I'm
Yeah.
excited for you to apply that with patients and clients. So is there, I'm kind of curious real quick, Gordy, then Dr. Gordy, then you can ask the next question. I'm kind of surprised you don't like cold plunging and cold showers if you're a Pitta type. Or are you just so balanced that you don't need to cool down so much?
Um, I do cold plunges, but maybe because I'm a tropical guy, um, there's a limit to the cold that I like. So every day in the shower, once I'm done, at the end of it, I do a cycle between cold and hot 6 times. So hot, cold, hot, cold, hot, cold, and then I end on cold, and then I step out. So that's my own
Nice.
way of doing that. Yes.
What advice can you give us members who are actually watching this right now, if you were to give them some health tip or advice, whether it's a child age or adult, what kind of wisdom and advice would you give that person?
There's a lot of things in Ayurvedic approach to nutrition that we don't have time to touch on. So I'm going to touch on just two of them. One is listening to our bodies. So this means mindful or intuitive eating. And the way to be mindful or intuitive when you're eating is to actually draw all your senses to that feeding experience. So you're eating in a quiet, calm place, no distractions at all, no TV, no books. You're not talking too much. You're there. And when your entire five senses are there involved, it's nourishing. That experience is nourishing for you. Even before the food hits your mouth, your body is already anticipating it and it's preparing. Then when it enters your mouth, again, if you're mindfully eating, you're chewing it and making sure that you're well chewed before you swallow it down. Before it hits your stomach, your stomach kind of gets a sense of what's coming. And secondly, if you're eating, say, like a starch, if you take enough time to chew it in your mouth, it's already broken down into simple sugar. So the work that the rest of the body has to do to further process it is less. And then in Ayurveda, we believe that poor digestion is what causes disease because then things don't break down well and then toxins accumulate. So mindful eating. Then even before you put it in your mouth, I skipped a step, is that gratitude. So the food is in front of you. You're expressing gratitude for the food. You can even say a prayer, thank the universe, thank whoever prepared it, and then you eat it. And while eating, you're also not drinking too much water. So just enough water to lubricate your meals, because the belief in Ayurveda is too much water during the food can dilute your digestive enzymes and then impair the digestion. So mindful eating. Then the other one that I want to quickly touch on is water. Most people don't talk about water when we talk about nutrition. Water in Ayurveda is considered to be like a detoxifying tool. So the first thing you do when you wake up is to drink 1 or 2 cups of water. So you wake up from bed, you walk to the kitchen, you drink warm water. Or if you're a pitta, then it has to be lukewarm. So the lukewarmness or the warmness of it is kind of, it wakes you up on the inside. It doesn't shock you up like cold water would. And then all the detoxification processes that happen overnight, we're also completing digestion of foods that wasn't complete because, we snack in between meals. So all that's also happening while we're sleeping. Even our brain is detoxifying too while we sleep. So all those synapses that are temporary can snip some off and strengthen others. So in Ayurveda, the belief is that now that you've woken up, you drink water to wash all those things out. Some of it will get absorbed back into your cells, into your tissues, and then the rest of it goes out. So shortly after that, you're likely going to go have a bowel motion. So that's how you've cleaned out. So I'll say 2 things that you could try that's not too hard are those I just described.
Oh, great. Thanks for sharing. The part that really hit me is at the beginning of that. All that was great. But you said about just observing your body, just sometimes I think a lot of times things are happening and people are too quick to jump to the conclusion, oh, I have cancer or I'm having a heart attack. Maybe true, but a lot of times people have these minor symptoms, but they're not observing why or how. And the other
Exactly.
things you said were brilliant. I loved it. Back to you, Mike.
That's super powerful with being grateful and mindful and prayerful and present with our food and slowness because digestion doesn't happen in 10 minutes. It takes an hour or two that's genius. That could change someone's life. That could improve someone's life. That could improve their digestion, their metabolism, their gut health. That's super powerful. I appreciate you sharing that. So real quick with that too, are you going to recommend vitamins, minerals, supplements, or do you going to help balance your clients just with food and herbs and natural things?
The former. So all that, including
Okay,
supplements as well. And mind-body methods like yoga or meditation, pranayama.
nice.
Yeah.
So where can our listeners contact you if they want to find out what dosha type they are and to learn more about this fascinating healing art and your integrative approach to health? I think it's really wonderful with your medical background and now your integrative functional medicine and natural health approach. I think that's just a great combination to help people with. How can they get a hold of you and if they want to work with you?
So I'm just starting a page because, like you've said, this has been so educational and interesting for me, and I want to share that knowledge. So I just started an Instagram page. It's called at Harmony 360 Health. At Harmony 360 Health. 360 is like 360 and then health. So if you go there now, you're not going to find much, but weekly I'm going to be posting something educational, something simple that can help people.
Nice, nice.
Yeah.
Yeah, Dr. Gordy, you can post that and
Yep, we'll put
Yeah,
that on the screen so everybody can read that and tap into your knowledge. And I appreciate you. I love talking to people in this wellness route, and I love your passion and helping more people. And I like that you're open to learning more and growing and just putting it out there. I think little baby steps will equal big, huge steps, and I'm sure you're going to be reaching a lot of people. So I'm excited for your new venture.
Thank you
So
so
thanks for
very
being here
much.
with us today, for
yeah,
sure.
great.
Thank you for having me.
Yeah, Dr. Akande, before we close, I just want to point out that I know you and I know you walk your talk and you take really good care of yourself. Do you want to just give us a 1 minute synopsis of some of your lifestyle habits that you do to stay congruent so people know that, hey, I'm not just preaching this stuff, I'm living it and I'm healthy and I'm fit. And tell us a little bit about your health and wellness lifestyle.
Three things I do. One, through the fellowship that they really imprinted upon us is to be connected with ourselves as individuals. And even before you walk in to see a patient, take a minute to drop the last patient, come back to yourself, and then go in. So I do meditation every day. The style that they taught in my fellowship is called transcendental meditation, 20 minutes twice a day. Most days I do two, some days I do one, but that's been really, really transformative for me. The other one I discovered during the pandemic is things that distresses me is being out in nature. So I take my bike and I go biking at least maybe 3 times a week. Just go through nature very slowly. I'm not going fast. I'm just like cruising through. And then the last one I do is to be in bed by 10. I try to be in bed by 10 and then be up by 6 because another thing with Ayurveda is we need to live our lives according to natural law. So nighttime is for sleeping. So go to bed at night, wake up with the sun. So I try to do that as well, and that's been very good for me.
Yeah, that's great. It's fun to talk to people, like you said, Dr. Gordy, that walk their talk, that are congruent, that just they live what they teach. So that's really fun. I'm excited to hear your journey, and we'll have to do a follow up in a year, like you said, and then you can, shine
Yeah.
some more insights into what you've learned from your clients and things. So as we close out all of our podcasts, I ask people, what was your number one takeaway from this interview that you can share with a coworker tomorrow? And what insights did you glean? And number two is, what action steps can you take? Are you going to really be more mindful? Are you going to work on digestion and slowing down and really listening to your body and exercising and being mindful? So I'm kind of curious what people's action steps are going to be from this, because I know it hit home because I ate really fast before this interview. I didn't taste my food very well. So I admit it, I didn't do too good today. So with that, any final thoughts, Dr. Gordy?
Doc, do you have any final words? Otherwise, I'll close us out.
No final words. Thank you again for having
Thanks for
me.
joining us. Thanks for joining us here on the Health Angle podcast. And if you haven't already, please subscribe. Please hit that notification bell, like our content. And until next week, we will have another edition at the Health Angle podcast. Until then, we'll see you then.
Thank you for joining us on the Health Angle podcast. Please subscribe to our channel and catch us for our next episode.